Good afternoon, everybody. Thank you for your time today joining us for this conversation, the second in an ongoing conversation with the Mayor's Office related to COVID-19 and equity. Today, we're going to talk about a number of areas within city government and also within our community in general. And we are going to take the time to really unpack this because we're looking at parts of city government that perhaps hadn't existed before and how the intersections really play in. Before we get started, I'd like to take the time to introduce everyone on the call and go from there. We've got some great folks from the team here with us today. And we'll start with Mayor Bill Peduto.
Hi, Josiah.
And Laura Dragowski, would you mind introducing yourself and your role?
Sure. Hi, my name is Laura Dragowski. I'm the Critical Communities Manager in Mayor Peduto's office, and I work in the Office of Equity for Deputy Chief of Staff and Chief Equity Officer Majestic Lane.
And Majestic.
Hey, good afternoon, everyone. Chief Majestic Lane, Chief Equity Officer, Deputy Chief of Staff to Mayor Peduto.
Thank you all so much for taking the time. Mayor, I'd like to start with you. Before we start diving in to this critical conversation, how are you doing this week?
Doing well. Had a good conversation with the governor this morning, looking at the numbers that we've been seeing in Allegheny County. I think it's fair to say that we have plateaued. We didn't really hit a peak, and that's really due to the work of the people in Allegheny County, the residents that allowed us to do what our goal was of flattening the curve. So it now appears that we're on the back end of that plateau. And as we see that, we see additional opportunities to slowly start to work towards the reopening of different things in the future. I think that we've been pragmatic on the approach we've taken so far. And I think that, with this latest news that has been data that's been coming in now since about the third week of April, we should be assured that we have been doing the right thing.
That's encouraging. You mentioned the word pragmatic, and that is a word that comes to mind when I think about the work that faces and serves our critical communities. Could you speak a little bit about why you created that position to begin with and what the purpose of that position is?
Yeah, so I've known Laura for a number of years, and I knew her as a Carnegie Mellon graduate in science, but she also had a very strong passion towards helping those that were struggling with addiction as the chair of Prevention Point in Pittsburgh. She went to school with our chief of staff, Dan Gilman, and had approached him about looking at basically a career change and being able to utilize a scientific background in order to be able to approach all of our critical communities and be able to have a one-stop shop within city government, within the mayor's office. Prior to her coming on board, we really never had a person who worked with our homeless community, a person that worked with those who are suffering from addiction, a person who worked with our veterans, a person that worked with those who were facing mental health issues where they needed assistance. And if you think about something like the shock that we're going through with a global pandemic, the folks that we mention in all of those critical communities live under a constant stress. And when a shock arrives, that stress becomes much greater than it is for anybody else. So as we're dealing with the physical health effects of a pandemic, we also have to be acutely aware of the mental health effects that are happening now and will happen over the course of the next several months. And what this position does is allows us to empower those that are on the front lines working every single day to be able to do even more. So whether it's working with our homeless and those that are visiting them in the camps, or whether it's those that are veterans or those that are recently incarcerated, who are trying to transition back into a life that will keep them out of jail. All of those different areas now have a person in the mayor's office that they can contact directly for assistance.
Thank you for that, Mayor. So this is something folks in Pittsburgh will be familiar with, that you've been focused on and paying attention to since your days in City Council. Now that you're mayor, and given the shock that you mentioned that's happening with COVID-19, what are your principal concerns as it relates to folks that might be experiencing homelessness, or folks that might be experiencing addiction?
So I'll let Laura answer more specifically, because she's literally on the streets working and talking with them. My involvement within Pittsburgh's homeless community goes back before I ever ran for office or was a council member, and work that I did with a number of shelters that then led to a program that we created when I was a staff member for City Councilman Dan Cohen. And my involvement continues through my days as a mayor within our homeless community. Looking at that one community, what's absolutely essential is that there are protocols that are being followed on a national basis in which we need to be able to follow as well. So if we're looking at camps, in many cases, people may be safer within that camp than if we were to take them out of it, but they need a place to wash their hands. They need a clean place to use for a bathroom. They need to make sure that they're getting food and they're getting checked on. And once we're able to identify somebody who may be infected, we have now set up with the county, EMS will take them to a hotel, and we're able to provide a quarantine safe area for them. But again, we have to look at the national standards, because you don't want to place others who may be at risk, but may also be diabetic or have high blood pressure or other types of risks that would make them even more prone should they get in contact with the virus in an area inside of a hotel. So I would say that the key areas are looking really within each of these communities at the best practice models that are being established on a national basis, and making sure that they're happening here in Pittsburgh and that we're taking it even beyond that.
Thank you. It's fascinating, because so much of the conversation around public health can remain, at this zoomed out level, and yet you hear this really practical blend here where you're talking down to the individual level. How are you providing services? How are you taking into account other factors that might be at play? What resources are there to be brought to bear? And then what does the game plan look like for that individual? Which I think is a uniquely interesting thing about city government and about our setup here in Pittsburgh, that we have the chance to do that. It occurs to me that in other larger municipalities, it might be tougher to get down, to that level. Chief Lane, I'd like to bring you in, sir.
I just want to add this, and Laura will be able to speak to it. People don't realize that those that are on the front lines of working with people who are living on our streets know those souls by their name. They know their circumstances that have left them on that street. They know where they came from and why they are on the streets. We are so blessed in this community to have a safety net service that actually does treat the individual as an individual. And in my little bit of participation on that, I have had that opportunity to see people's lives change firsthand by the individual attention we're able to give people who are suffering from addiction, people who are suffering from mental illness, people who are suffering from homelessness. I have been able to see that transition where they now have an apartment and they now have a job and their life has been completely changed. And it is because in Pittsburgh, we're able to get down to the point of knowing the individual and not just the status of where they are today.
Thank you, Mayor. I appreciate that. Chief Lane, would you mind framing for our conversation the purpose and the mission of the Office of Equity, and then how, with COVID-19, what role the office plays when it comes to these specific examples that the mayor is bringing up?
Oh, thank you, Josiah. I think, the role of the Office of Equity is really to look at applying an equity lens to what we do inside of our city. Equity is not a luxury; it's a priority. It has to happen, and I think COVID, as we talked about before, has really exposed fault lines and crack lines in our society that people may not have seen. The tenuous livelihoods and the tenuous experiences that people have been having. Now, we know that certain communities have been having those prior. So they've been dealing with various stressors before, but when we all had to deal with a shock, as if we were dealing with a global pandemic, now we see the stressors that are coming from it. And we can see vulnerable communities, vulnerable people, right? And they're not vulnerable just because of themselves or individual decisions. They're usually vulnerable because of a system. They're vulnerable because of a system that has not served them well, or a system that has failed them. So really it's taking a look as a city and acknowledging that, as the mayor often says, if it's not for all of us, it's not for any of us. And what I mean by that is the health, safety, and welfare of all citizens. So we have to look at the health, safety, and welfare of every citizen in the city as important. And sometimes it always includes people who are not always seen. And those are the people sometimes that are stepped over. Sometimes those are the people who are right next to you, who are in a particular community. And that community is not because they're different. That community is folks who share similar challenges, but they're all part of our community. But the mayor has identified those populations, if you will, as critical to be able to make sure that the entire city is rising, not just some of us.
Thank you. So you mentioned this idea that there are existing inequities, and some of those being structural in nature. And the COVID-19 is exacerbating and perhaps for a lot of people clarifying or underscoring those realities. When it comes to the Office of Equity and just this conversation around equity, what is it important to keep in mind as it relates to poverty that folks might not consider generally?
So I think, number one, that it is often framed in our society that poverty is a host of individual decisions. It's the result of a host of individual decisions that someone made versus what someone else made. And all the research and everything that's been coming out for years now, for decades, shows that poverty is also about a system. It's about a system that privileges some over others. It's about a system that some people make a lot of money and some people make just enough to get by. And what we see in this example is that many people were making enough to get by, but not enough to save, right? And we're seeing that a lot of people were vulnerable and 1 month away from eviction, that they're 2 weeks away from not having enough food. So this is just a structure of looking at what is the kind of social safety net to get everyone a quality of life so that they can acknowledge who they are and find their space to be the best citizen that they can be. And what is society's responsibility? And, as the mayor said, cities traditionally haven't gotten into this. This has been the federal government. This has been other people, sometimes even philanthropy or charity. But I think this is an evolving space where cities acknowledge that if you want everyone to be okay, you have to at least try to serve in a cross-sectoral manner. You have to serve in a manner that goes across silos. You have to serve in a manner that works to convene the resources and combine the activities in order to create the outcomes that is best for everyone.
So, it's interesting you mentioned the idea of serving everyone, because I think it would be a mistake or perhaps an oversimplification to equate, even rhetorically in our conversation, the idea of homelessness and poverty, because people can be experiencing homelessness that aren't necessarily poor. And I remember when I worked at the Home of Children's Village, you could be talking about young people that are just, between places to live, that maybe just don't have an address or living with friends and what have you. And given your point that, it might not often be city government that's engaging in this way, how do we go about getting an understanding on what the situations are as an office and as a city government?
Yeah, I think it's a lens change. It's a lens change to understand that people without an address are just like that. They're people without an address, but they're people first. Often we'll say that's a homeless person versus that's a person without an address at this point, because it's a phase you can be going through versus a stigma, right? So one, how do we get past the stigmas? How do we understand the public responsibility of caring for each other? I think COVID has, again, brought out the idea of what is the individual's responsibility to the collective. What are our responsibilities to keep people safe? What are our responsibilities to keep people okay? Well, just like we talk about this new normal, we have to carry the idea that we're all responsible for each other into our recovery, right? And that could mean folks who are dealing with anxiety and mental health challenges, mental health opportunities. That could mean folks who are without an address. That could mean folks that may have seen the confluence of factors that affected them and impacted them, so that they're dealing with addiction challenges and whatever have you. So, it's about how do we shift our lens, and how does the city lead by example? We're trying to shift its lens to acknowledge that that while you're dealing with issues like homelessness and opioids, you also have a lens of your gender on it. You also have a lens of class on it. You also have a lens of race on it, right? You also have a lens of sexuality and orientation on it, right? So these are all things that are also lenses upon that. And I really tip my hat to Laura for also seeing those confluences to not just acknowledge that addiction and it's just addiction, or homelessness is just homelessness. We still find disparities according to race, class, and orientation and age, even within those things in those critical communities, and taking that lens and that critical lens to it to allow us to get more done and serve people in the best way possible.
I want to turn to Laura here in a moment, but one last question for you, Majestic. You've been working with the Housing Opportunity Fund now for a while, and I wondered if you could speak to mechanisms or resources that are in place or could be in place in the future as we build toward this new normal that can help address some of these concerns, reduce harm, and put people in a better position, help them get to a better position.
Yeah, well, one, I want to say to our authorities, the Urban Redevelopment Authority and the Housing Authority of the City of Pittsburgh has been really working with us and really having a people first lens and being people centered and making sure that people were not going to be evicted during this time. Resources that we found via CDBG funds, and also resources that we had in play prior around housing stabilization. And we look at housing stabilization as eviction prevention. We know that if people are $400 and they get kicked out, that $400 now turns into a couple $1,000s they have to get for their next apartment. So even a little bit of help in the short term can stop someone from becoming evicted, which we know that eviction and that homelessness, or that being without an address, now changes what goes on emotionally. It changes what goes on educationally. It changes what's going on with the ability to work. So we've been doing that. But also beyond that, we identified and we've been thinking that small interventions can have a big impact. So we've been working with our Commission on Human Relations in our office and within our office, and also with kind of external stakeholders on really thinking about where is a place that an appropriate intervention could be, let's say for a mediator to be able to come in and think about how can you partner and work with maybe a large landowner, or how can you work with a judge or magistrate. Where can we find places to try to mediate to keep people safe, right? As much as we're doing work, and Laura will talk about a lot of it, they're trying to do work to create the high quality, top of line shelters and the opportunities for living for folks who were don't have an address. We also got to try to keep people out of that cycle. So we're trying to work on both sides, whether it's the resources, but even now the mediations, to really think about how can we intervene. And this intervening, again, is not going into social services, acknowledging that as a city, we have a role to try to minimize the affordable housing problem, that we have a role to minimize the separate, the education gaps that often come from young people being in stressful and traumatic situations. So this is really about keeping a city that works for everyone. And so you'll see in the next couple weeks and months, really an interesting pilot program that we want to expand to really look at eviction innovation. It's an idea that's taken hold across the country. our city, along with the National League of Cities, has convened folks from all across the country in a cohort to really look at what is eviction innovation. And so how do you work on one level to keep people from being evicted? And on the other hand, how do you get folks who may be experiencing homelessness at this time the opportunities and the resources they need to stabilize themselves?
Thank you, Chief Lane. Laura, let's turn to you. So you are someone that I have learned so much from since joining the mayor's office. And I always enjoy opportunities to talk with you about your work. When I think about it, two terms come to mind, and we've talked about this before, and those are access and accommodations. And I just wonder how you would, with those terms in mind, explain to those that may be watching what your role is and what you do.
Right. Josiah, thank you. Mayor, Chief Lane, also Heather and Nicholas, thank you so much for accommodating us today as well. I've been working in the mayor's office since 2017, and I think the most important thing that I've learned from the mayor is that you learn best by listening to our communities, by finding a way to accommodate their needs and understand their narratives. For some people, it's more difficult to have that access than others. If you're a person experiencing homelessness, and I know this is something that we hear from our community members all the time, how are you able to advocate for yourself? How are you able to be accommodated in the decisions that will ultimately affect you? The same thing is true for a person living with a disability. How are we ensuring that that person's perspective and experience are accommodated in the choices and decisions that are made? So critical communities, as the mayor often says, is making sure that we provide those accommodations and we promote that access, and letting people know that we care about what they have to say. Because candidly, what we'll find is we'll do something and they'll come to us after and say, why did you do this? I could have told you it wasn't going to work. And why would we need to, let's say, walk a mile in someone else's shoes? If they can tell us about that and we can trust what that was like, and we can be a lot more efficient and effective in understanding it. So I have the opportunity to work with a really wide array of people, people who use drugs, people who are displaced in precarious situations, experiencing homelessness, individuals who have served our country and come back and have accommodations that need to be made for people to either understand their experience on a professional level, or maybe thinking more from a mental health level or a trauma level. So how are we accommodating that? Our partners in the age-friendly community, how are we making sure our seniors are integrated in intergenerational ways into our lives? So it's a privilege. And I think we always want to be thoughtful that we're not grouping all of these individuals together because they are all requiring the same accommodations, but rather, as Chief Lane says, there's this sort of tapestry or fabric of equity. And when we think about that, all of those individuals and their experiences are interwoven to create that tapestry. And that's what's really rich and important, I think, about our city and our communities.
Thank you. So when I hear you describe it in that way, what comes to mind to me are intersections, the intersections of the various communities and what they may be facing and experiencing. Could you speak a little bit to that? And if we're trying to make accommodations, is it useful to think about these services as just a privilege that we're trying to engage people with, or is there another way to think about it?
Those are really important questions. I might start with the latter question, which is privilege, right? I think that through this crisis, we have probably become more acutely aware of the privilege of health, the privilege of shelter, the privilege of well-being. And I think we all agree that those shouldn't be privileges. A person should not suffer from a respiratory virus that could kill them because they don't have access to health and well-being services. Likewise, a person sheltering outside, we want them to be accommodated in their own home in a safe place. There's this recognition that we have systems in place that make these resources, make these rights more of a privilege. And I think maybe more so through this crisis than others, we're recognizing they can't be privileges, or we will continue to have inequity. And to your other point, intersectionality, I think that equity provides that lens, that that fabric or that tapestry. But I think there's also conflation, right? I think there's a lot of stereotyping. If a person is experiencing homelessness, we assume they have problematic substance use. We assume they have untreated mental illness. And there's a whole host of reasons why a person might experience homelessness. There's a whole host of reasons why a person might use substances in various ways, not always problematically. It's sometimes a very unpopular thought, but substances can be really effective in helping people to cope with the experiences that they have in life. So there's an oversimplification, I think, that often occurs when we want to just put people in a box and then figure out how we package that up and put it somewhere else. And instead, we really want to unpack that box. We want to recognize the individuality in our communities. And we want to recognize that, and this is something, that the mayor and you, Josiah, were saying from the very beginning, that every person is a person. And we have this privilege to try to learn from each and every one that we interact with, especially even our direct service providers. I had an opportunity to speak with our assistant deputy chief in the Office of Community Services at DHS, who happens to be a mayor's office alumni, Cynthia Shields. And it was really important. She reminded me that we think a lot about essential workers and how we're recognizing them during this crisis and how maybe we didn't before. But I think the important thing is when we want experts, we need to go to them, as the mayor said. We can go and speak to, the founder of street medicine in our community and understand exactly, and his teams, and understand exactly what people are experiencing. We can go to the people and understand it so they inform the decisions we make so that those decisions are efficient and also effective. So I think that what Cynthia shared was, if we're going to have free coffee, let's also think about our shelter providers and our direct service workers and behavioral health communities and substance use services communities and harm reduction communities as well. But I think that, again, as we think about intersectionality, there's also this real differentiation of the individual.
You mentioned the individual level. You're one of the people that the mayor referenced that, on a person by person or a name basis, knows many of the folks that we're kind of referring to in this framing. I want to take advantage of having you on the call. Let's just jump right into it. What are the greatest challenges for people who are in precarious situations right now? And given that, to the mayor's point, there's a shock to the system, what does the process look like of reconciling those barriers to not just getting them access to services and accommodations, but towards this new normal?
That's a great question. So I think, maybe I'll start with substance use. I know that the mayor spoke that I, for many years, worked directly with Prevention Point Pittsburgh. And Prevention Point Pittsburgh is a syringe service program and harm reduction program that's been operating in the city for 25 years. And notably has been here, literally handing out sterile supplies for 25 years with no incident and a great deal of harm reduction and prevention in the community, which, we all know is the more effective way is prevention. In the time that I spent with the people using those services, the one thing that became very clear to me, and certainly was clear to the people who have done this for a long time, is that to Chief Lane's point, these are people. They're not addicts, they're not drug users, they are people first. And it's very rare that their humanity, that their person is recognized through whatever else they're going through. And so through the years, I saw, a host of people go through different experiences, but the one thing that resonated in these experiences was that when they got to sit down, have a candid and honest conversation about what they were going through, and could get what they need without having to represent some reason to deserve it, or without having to justify it, it was a weight lifted, because it recognized the individual agency. It recognized that, hey, we're not here to judge you. We want you to be safe. We want you to be healthy. We think those are rights, and this is how we can accommodate. So, in looking at those individual experiences, we learn so much. And then in speaking with our providers and our direct service providers, especially the people who are, our harm reduction specialists, our social workers, our case managers, our outreach workers, our community health workers, those are also the people that can give us some of the greatest insights about the ways in which service can be improved. But of course, it's difficult to elevate those voices because they're busy, right? They're really busy. So I think that what we have demonstrated to ourselves is that we can change things. I mean, even during this crisis, we're seeing rapid response and change, which is incredible. I mean, we're seeing new ways that our partners who are working with the health department are making sure that naloxone, which is the overdose antidote, is available to people. We're seeing our EMS teams using telehealth. I know the mayor spoke about that last week, using naloxone leave behind to make sure everybody can have access to the life-saving medication. We are seeing our substance use treatment providers making take-homes available, which is something that people have feared for so long because of the stigma around medication that's used for recovery and support. But you know what? We can do it. We just proved it to ourselves. So I think that the important thing here is to recognize that our experts who have been telling us that some things that feel uncomfortable, but that we know work, we can do those things. We can recognize agency, we can recognize autonomy, and we can promote the safety of individuals. And by doing that, we'll actually, I think, all become even more resilient and we'll have a more equitable approach to people. So, very simply, seeing that individuals who use drugs, working directly with our law enforcement, our public safety to find accommodations and resources other than incarceration or criminal justice involvement. That's recognizing that a person has a reason why they use drugs and that reason is complex and that they may be an individual who is in need of resources, but certainly that incarcerating that individual is not going to change the outcome for them. So I think it's about recognizing that we've, under duress, proven that we can make these great changes, and why not do it, as the mayor said, as a preventative mechanism, as Chief Lane said, rather than waiting for the harm to befall people.
Yeah, and I just want to jump on one of the points that Laura just made. You'll hear from individuals. You see these homeless people that are gathering in downtown Pittsburgh. Well, the reason that they're gathering in downtown Pittsburgh is that's where all the services are. The services are concentrated because they don't have cars. They don't have disposable income for public transit. And being able to see somebody about that toothache and being able then to get food and have a meal and to be able to do some laundry needs to be in a concentrated area. So as we're seeing the economy, and this is well before COVID-19, shifting in areas like Westmoreland County, Butler County, Beaver County, Washington County, their areas of providing services are being stressed and the residents are coming here in order to get help. And so you'll see more people on the streets of Pittsburgh. And then the other reaction is they should all be arrested. Just arrest them. They're loitering. Number one, they have a constitutional right to not have a home. That's not a crime. It's not part of the criminal code that you cannot and have to have a home. There are many people that don't have a home. And we don't just round them up with police or public works. In fact, we did that for decades. We did that. And that second point, they'll get the help they need in jail, has proven to be a false promise for decades. Since we closed down mental health institutions in the 1980s and the 1990s, our number one institution for treating people with mental health is our jail. And we have to do better than that. And here's the thing, we have the capacity with nonprofit organizations to let that person be somewhere else where they will get the actual help they need and not just put them under the rug or sweep them away and say the jails have the programs that will actually help. That hasn't worked for decades. And that's not an indication of any one jail. That's the entire system within this country that is broken.
It's such an important point, Mayor, the historical context. And what strikes me is the contrast in philosophy on those kinds of interventions, to your point, and what Laura is describing, whether it's the work of Prevention Point or others in our nonprofit community. Laura, just in terms of level setting for folks that may not be as fluent in the space, what exactly is harm reduction, and how does it inform why you might have something like a syringe service that might be startling to people that haven't considered that idea before?
Right. It's a good question, and I think you're right. When you haven't thought about it, it can seem counterintuitive. So harm reduction generally is, what are the ways that we can move to reduce the harm associated with any behavior or activity? And there's key principles like self-determination. So we're not going to tell someone what to do. We're going to ask them what they're doing, and then support them in reducing how harmful that activity is. So the classic examples are wearing a seatbelt in the car, or wearing a bike helmet when you're riding your bike in the city. Sure, we'll get some comments on that one. But there are a lot of ways that we can reduce harm in everyday life. Washing our hands. We're in the middle of COVID-19. So if you are going to go out, wear a mask, wash your hands, you reduce the potential harm to yourself and others.
20 seconds.
Sorry, 20 seconds.
20 seconds.
Happy birthday twice. So there are really broad applications for harm reduction. When we start talking about things like substance use, we recognize that even in a pre-COVID era, there were concerns about bloodborne infection transmission. So hepatitis C transmission or HIV transmission. We think about having abscesses or endocarditis, which is a heart valve infection, all of the things that can occur if we don't have sterile supplies. I don't know. I don't think anybody should be subject to harm because their use, involves a needle. And certainly, I think if you're a person who doesn't think about it that way, but looks at the cost, harm reduction is far, far more cost effective. You're preventing all of the associated medical treatment and care for a person, and instead can have a real conversation with them, meet them where they are, which is an often used phrase, and support them. I think we recognize that just because someone says you need to change doesn't mean you need to change. I think I keep telling myself I'm going to get up every morning and go for a 5-mile walk. And I haven't done that. And I don't know that someone yelling louder at me to do that would change me. I don't think that's how human behavior is playing out. So what we do is we meet people where they are, and we recognize that we promote their safety. We help them to be in as safe a place as possible. And then if there's a next step, whatever that looks like, they trust us to come back and say, you know what, I think I'm ready to move to a different supply. I think I'm ready to consider medication and possible recovery options. I think I'm interested in mutual aid meetings. Hey, whatever a person decides, we're just promoting movement toward health and well-being. So I think in the COVID era, we're now thinking about sharing cigarettes, sharing any other smoking or snorting materials, which is not something we've thought of in the past, right? And probably there's really significant conversations to be had even in the inequities of how we've approached substance use. I know Chief Lane and I have talked about this at length. As we saw the demographics of substance use change over the last 15 years, we've seen a shift in the way that we as government, as law enforcement, as healthcare are responding to individuals. The substances solve the same problem. They serve the same needs, but we have different demographics and different substances. So it took COVID for us to start thinking about, for many organizations, not Prevention Point, but many organizations to think about safe snorting and safe smoking. And I think, we have these kind of deeper level conversations about how we keep someone healthy and safe, support them in being healthy and safe, and recognize that our definition of healthy and safe doesn't have to match theirs. So harm reduction has very, very broad impact and implications, I think, in this crisis and beyond.
Yeah, perhaps another conversation to do a deeper dive, on that and the evidence-based best practices that have been employed or utilized by organizations. Chief Lane, I wonder, when you hear this conversation around harm reduction and the philosophy of meeting people where they're at, is is it possible and appropriate for government, for city government, to engage in that way as well, especially through this lens of equity? And I think you're muted, so there we are.
Yeah, I think it's the changing landscape of cities that you can't leave an issue to someone else. And for years, whether it was mutual aid or philanthropy or somebody else was supposed to solve a problem, and cities were only supposed to be concerned with certain amount of things. And we just see that is not how high performing cities function. I think COVID again has brought to bear, ideas around being considerate, compassionate, right? Equitable. We're talking about all these kind of things that you didn't fundamentally, that's not how you define cities and cities' role in those kind of things. So I think we're opening up to acknowledge that around harm reduction, that around a lot of these challenges, that cities have to start being partners with those who are also doing them. Health departments, because health departments often, again, understand public health and the role, human services. So cities are a part of it, but cities have to have a lens to not be siloed. Cities have to have a lens to be cross-sectoral. A lot of the great work that Laura and other members of our team do is really cross-sectoral. I mean, it cuts across, meaning we may be having conversation with street medicine groups. We may be having conversations with the Redevelopment Authority. We may be having conversations with the Department of Human Services. Why? Because we acknowledge that in order to engage these, what they call Harvard wicked problems, or just challenging multi-generational problems, you can't just solve them in a silo. And no city can in a sense try to wall itself off to its issue. You can't wall yourself off to the issue of people without addresses. You can't wall yourself off to the issue with people who are having mental health challenges. You can't, or emotional health challenges. You can't wall yourself off to people who are dealing with addiction. And we know, to Laura's point, that in the past we did wall ourselves off. We did other people when it came to their challenges, and we other people who were dealing with substance abuse challenges, and we criminalized it. And we criminalized it according to race and gender in neighborhood. And we see the costs that cities across America are still paying because of that decision, right? So to me, the decision that we've made to move and evolve past that is not, it is the moral choice, but it is actually the intelligent choice for a city and a mayor to make, right? To make sure we evolve past criminalizing challenges. And to Laura's point, we have to continue to be thoughtful around that, because if someone takes a different drug or different substance, but how do we make sure we show them the same concern? So we can't say, okay, so one substance we have a lot of love and appreciation for, but this other substance, no, that's a bridge too far, right? So that is the lens of equity and the lens of class and the lens of gender. We can't make one thing okay, but if another gender does something, that's not okay, or folks who find themselves in situations. So that's how we really have to work together and always lift up and be people-centered, while acknowledging we can't solve it all. We acknowledge that we partner with folks who can create a landscape for everyone to flourish within our city.
Yeah, certainly. The idea that we're somehow going to avoid costs by ignoring it, or pretending for some reason that there's such a thing as other people's kids, does nothing to change any of the factors or situations that we're speaking to. And this is also a space, and the different buckets we've mentioned and the different entities, where people, even in this crisis, have stepped forward. And so I want to open it up to all of you here. Who are the helpers in this space? Who has been stepping forward and in city government, but then in other sectors?
Well, I'll start and I'll be brief because I don't want to mention specific organizations. The one that I'll skip will probably be the one that's done the most. But there are organizations that have been there for a number of years that have worked on issues from the largest of our hospital networks, AHN, UPMC, to small nonprofits that are led by one community leader who is assisting in getting volunteers out of a neighborhood in order to be able to address the problem. Let me just put it to you this way. There's two types of people. There's the one that says, this is a problem, someone ought to fix it. And then there's the others that roll up their sleeves and actually do it.
Chief Lane, I can chime in there. So I think that to us, it's our direct service providers. I think recognizing that they, before this crisis, went in every day and took that work at the end of the day home. Saw things that were unjust and saw things that were unfair and hard to see, and then went home to their families and got up and did it the next day. It's particularly hard, I think, on a lot of our direct service workers right now, because we have people who feel, and I know the mayor said this last week, sidelined, but we've seen a lot of them say, it's about the people. I know that there are a lot of other unmet needs. I'm going to find a way to meet those needs. I'm going to get food out. I'm going to leave harm reduction supplies with appropriate social distancing. I am going to go to Pittsburgh Cares, and I'm going to be a buddy to my next door neighbor or someone in my community. So I think there's this adaptivity, innovation, creativity, and recognition that it's about the people with whom we work. And maybe not always about that specific service that we provide. I think, we also look at our own public safety. This is a difficult time. I think it's difficult for everybody. Public safety has adapted in a lot of ways. But as the mayor mentioned, our EMS professionals have been leaders across the region and have been, diligently preparing not only to manage this crisis, but all the crises within crises that are occurring. So we have had just this continuity and excellence in our first responders. We can even look at some of our folks that, we sometimes get concerns expressed about people who are unsheltered being outside on the sidewalk. That's a difficult thing. Congregate settings right now aren't always the safest, and that's a paradigm shift. It's something that the CDC, the health department, DHS, our provider community are showing a lot of leadership. It's not been solved. So we have people outside, and we have partners in police making sure that people have masks. We have partners in the provider community that making sure we have hygiene stations. And so we are being innovative. And I think, the other thing is that we're preparing people. We can look at our academies. They're recognizing that we have to adapt, change, and support what's next to understand our communities and the changing roles that we have. So I think we have people who are responding, who are innovating, and who are thinking forward, what's next. And then the people who are just chugging along because their work is essential and they haven't gotten a break. And I think we're grateful for all of those helpers.
That's wonderful. We're going to bring our conversation to a close. Could spend all day with you all exploring these conversations, these topics. And I want to acknowledge too that our team has been fielding questions and posting resources as well. And you can go to the city's COVID-19 webpage to see those resources specifically articulated both now and after the call as well. But in terms of practical takeaways, a question that I certainly often get is what can we do? Like what can I do to be involved? How can I help? What's the answer from you three? And maybe Laura, we'll start with you on if folks want to support any of the buckets of activity that we've mentioned today. What's the answer for them?
That's a helpful question. I think in times like this, sometimes our knee-jerk reaction is action. And we see all of the precautions, all of the sacrifices that are presently being made. So I think the most important thing is that what we're doing, we also have to ensure the safety of the people with whom we intend to serve, or who we intend to serve, and ourselves. So that may mean stepping back and not doing the thing you would normally do, but rather partnering with an organization that has the expertise and the understanding of how to approach the situation thoughtfully. And that could be, going through the food bank or Pittsburgh Cares to find formal volunteer opportunities. But it's really being thoughtful and not just reactive. And I think that's, again, we've talked about it, that's exceedingly difficult, but there's a way to do it. And there are a lot of partners out there that are willing to talk you through it. And I mean, certainly we can also say if you have resources to share, the Pittsburgh foundation, the Foundation Communities Emergency Fund, is certainly really assessing carefully all of the work that's being done and helping to make sure that we move forward.
Yeah, I would just say exactly what Laura said. When we're dealing with communities that are homeless, that are addicted, that are facing mental health issues, that are veterans that have not been able to transition back, or those that are recently incarcerated, there are professionals who are trained in being able to provide the specific assistance that those folks need that will help put them back on their path. Don't try to do it yourself. Work through those organizations, because sometimes your good intention may not be the proper way of helping somebody who needs help. Even though you think that it may be and you're doing it for the goodness of your heart, it's better to find an organization to work through and to become a part of their efforts in order to be able to help our neighbors get back on a different path. And if you don't know where to go to, here's one place that's very simple. www.bigburgh, B-U-R-G-H, just like Pittsburgh, bigburgh.com. All the different agencies that are out there that offer free assistance to anybody in need. So if you find yourself in need, and it may not be that you are in any of the situations we talked about today, because that was our focus today, those critical communities. If you find yourself needing anything, go to bigburgh.com. And if you want to find an organization where you can help, go to bigburgh.com.
All right, thank you, Chief Lane. Any thoughts there?
No, just I would focus and talk about the role of the individual. One way we can all be of help is to change our lens. And again, I would look at seeing people as people, right? Not starting an addicted person, but a person with a challenge. Not a homeless person, but a person that's temporarily without an address, right? And I think once we change our lens, once we have more of a lens with seeing people as who they are and seeing people as not their situation, but who they are intrinsically, then we can start to change as a city and identify who needs help and start to apply more of an equitable and fair and just lens.
It's well said. I will speak for myself. This is certainly a learning journey for me. I feel like even on this call, I have more terms to look up and deepen my understanding around, just so that I have more of a chance to have a more nuanced understanding as time goes on. I'd like to bring this conversation to a close. I'd like to open it up for any final words from our panelists here today, from our conversationalists here today, as it relates to the conversation we've had, or just general encouragements on what to pay attention to in the days ahead.
Handing it over to Laura.
I think what we can say is that the most important thing is going to be collaboration, listening to one another, recognizing that this is new. We're going to figure a lot of things out. We're going to be honest about what we don't understand. And we're not playing a blame game here. We're playing a listen to the community, collaborate, and work as hard as we can. As the mayor had said, roll up our sleeves, work as hard as we can to figure out how we address the inequities and the harms that people are facing right now, and do as much as we can, as Chief Lane said, to prevent those harms. But we have really good partners in this region. We're really lucky. There's tremendous leadership. And I think that this is why we bring it back to the city, to the nonprofit community, and to the individual community members. We have a lot of faith in all of them.
Alrighty, barring any other final words, I just want to say thank you to each of you for spending the time and for being thoughtful around these issues, and for all of the work that you've done up to this point, both known and unknown, because certainly you all are some of the busiest people that I know, and I certainly appreciate that. There will be the next of these conversations on Thursday, speaking to the Welcoming Pittsburgh work. This is work, look at a lot of the same intersections in a lot of ways that serve our immigrant and refugee communities, new neighbors to the region, and tremendous organizations work in city government, philanthropy, etc. There as well. So please tune in to that. We will do our best to answer questions that have come up in the chat and correspond with folks offline individually. And please look at the official city page and the other resources posted for more information. In the meantime, thank you all so much for tuning in, and we will see you next time.